There's nothing more rude or insulting than being dismissed as a provider. And I've seen this time and time again that chiropractors enjoy working with us because number one, there's a level of trust, there's a level of integrity, and they know wholeheartedly that their patient's coming back to them and that we are going to work together.
Hey, Smart Chiropractors. I'm Dr. Jeff Langmaid, part of the Smart Chiropractor team, here with Dr. Jason Deitch for clinical conversations, and we are back with a very special guest who's making a return appearance, and that is Dr. John Schultz. Dr. Schultz, we really appreciate you coming on. We're going to talk all about posture today, which is what our doc's monthly campaigns is all about, but I want to thank you for taking time out of your busy day to come on, chat, and talk clinical stuff with other docs. We appreciate it.
Well, thank you, Jeff and Jason. It's always a pleasure. And I can't underscore how important posture and alignment is. So thank you for bringing up a critical issue.
You are more than welcome. I'm going to kick it off with a question right now, and that is, how do you think about posture, and how does it play a role in what you do each and every day in your practice?
Yeah, so unlike many medical doctors, we believe posture and alignment is central. In fact, we have an acronym called SANS, S-A-S, and we use that module to what's called symmetry, articulation, neuro, and stability. Okay, so you have to have posture alignment. And it's critical, whether it's in the cervical spine, in the shoulders, and we take lots of time up front in our evaluation and show the patients. And then I can tell you wholeheartedly, we utilize providers all throughout the nation, the chiropractors, because your community, you guys know this so much better. We don't have the bandwidth here at the Centeno-Schultz Clinic, so we rely on you all because that's when gains go from marginal to accept. If you don't have good alignment, if you've got forward posture, that iPhone or what used to be a BlackBerry posture, you're going without a paddle upstream. And that's why it's just so important. And so just a shout out to all the providers that help us help our patients.
Dr. Schultz, I want to make sure everybody watching really knows what this is really all about. It's clinical conversations. And, we've been working very closely with you and your partner, Dr. Chris Centeno, at the Centeno-Schultz Clinic in Broomfield, Colorado. World-class medical doctors and osteopaths that do everything possible to help your patients avoid dangerous drugs and dangerous risky surgeries. And that's really, the alignment and the synergy between our groups. Some of our smart chiropractors in our group, clients probably wondering, why do you keep bringing these medical doctors on when we're smart chiropractors and this is our group? What are they doing here? We find any type of doctor, especially that is aligned with our philosophy. We really want to focus and highlight you to our people because, there's been this schism for so many years that, as you said earlier in what you said, that most medical doctors don't even pay attention to posture, let alone alignment, let alone nerve interference, or what we refer to as subluxation. So just to create some context for those listening, there are more and more medical doctors that are embracing and understanding our perspective of a holistic body, controlled and coordinated by the brain and nerve system, and the impact the spine has on that. Dr. Schultz, I know we're living in the world of what we refer to as tech neck syndrome. You see more and more last month about children and pediatrics, this forward head posture thing. What do you tell your patients when they come to you typically, after they've had a crisis, after they've had an injury, they're looking for a more holistic perspective, drugs and surgery where possible. How do you coach them? I know that you focus on using orthobiologics to tighten ligaments and therefore create stability in the joint area. What do you coach them to do, when they leave your office in order to sort of get back to life and not allow the same habits and patterns to continue that caused them to probably come to see you in the first place?
Great question. So Jason, for your audience, just to let everybody know, for the last 16 years, our clinic has been dedicated to the treatment of common orthopedic conditions utilizing PRP or bone marrow-derived stem cell. We turned away a very successful practice of medicating, steroid injecting, and all sorts of provocative needle work. So we are in alignment with you. When a patient comes in that, shall we say, is compromised, who has poor posture leading to dysfunction, I'm very clear, as was the rest of the clinic, our stem cells, our platelet treatment will not be effective unless you can get neutral spine alignment. I don't care how gifted you are. There's no pixie dust. So we start with the basics. We start and refer them out so they can get good posture, and then we bring them back. Because if you do it the other way around, you only get marginal results. And we're committed to exceptional results, just like you all.
Dr. Schultz, I appreciate that, and I'm going to ask you I'm going to geek out with you a little bit here on specifically the science, because Jason brought it up, and I think it's a very important aspect, and that's when we think of posture, I like to think of it as whole body, regional, and even gets down to segments, right? Segmental. And at a segmental level, when you see an area that's hypermobile, and you're getting in there and treating a ligament, how does that work? I guess as deep as you want to go, how does it work? How does what you do really solidify and strengthen and add stability to that area? That's something that I've always been curious about, and I'd love to know your thoughts on it.
Yeah, so first and foremost, you've got to be able to visualize it. The days of blind injection are gone. The Model T was an automobile that is long gone. And so too is blind injections. That's first and foremost. So in our clinic, we are absolutely committed. It is the bare minimum standard of care that you have to visualize the target. So that's either with ultrasound or X-ray or both. That's bare minimum. Number two, just because I have my needle in the quote right place, how can I confirm that I'm actually injecting the right target? You put in some contrast or dye. And so if I want to see for example, the nuchal ligament or the interspinous between the spine and spine, I put some contrast in and I confirm both in an AP and lateral visualization. And it's only then that we know we're in the right position, and then we inject different substrates. Typically, we're injecting PRP or bone marrow stem cells. PRP is rich, as you know, in growth factors. There's a whole litany, and I don't want to bore you, especially during a lunch hour. You fall asleep. But one of them is very effective in increasing blood flow to those areas that have been damaged. It's sort of like water to a garden in the desert, is critical to the healing. So bone marrow has growth factors and then actually stem cells in it, and it is even more additive. So on a very basic level, it gives those ligaments, those damaged, stretched, torn ligaments, ammunition with which to heal and to strengthen. I'll let you know that we've been working with ligaments for over a decade. We pioneered the first successful treatment for anterior cruciate ligament tears. Yeah, that's right. I mean, you don't have to have the darn thing cut out and then go through rehab. A ligament can heal, and we have 2 studies already that have been published, and we have MRI results. If anyone wants to look at it, it's online, that you can successfully repair a torn, partially torn, or a full tear, non-retracted ACL tear. The same is true in the cervical spine, the shoulder, the thoracic spine. So I hope that answered your question.
It does.
I'm gonna see if I can sort of translate and simplify and just make sure I'm hearing it.
Yeah, I'm sorry. You asked me to geek out.
That's the Jeff and I is, Jeff likes to go deep and scientific with love, and I always learn a lot about. But I like to keep it so I can just make sure I'm actually understanding all that deep. So no need to apologize. one, what I hear you say, specificity matters. I know that that's a big word and a high value for chiropractors. And one of the many distinctions that we make when people ask questions to us, like, well, I went to a physical therapy, manipulated me, or I went to an osteopath and they, cracked my bones and did a few things. And people come to us as chiropractors and say, well, isn't that the same thing? And your words were, gone are the days of doing things blind, meaning that you're using, whether it's ultrasound, X-rays, you're using visuals, as in not blind, to see specifically where you are injecting the different orthobiologic, because the right stuff in the right ligament or right joint makes all the difference in the world. Do I got that right?
Bullseye. You got it.
And that's the same thing for us as chiropractors, is that, there's other health professionals that are just like, look, I can do what a chiropractor does, crack, thinking it's the same thing. But in your language, we would say like manipulating or adjusting blind. And not being specific to the specific joint or area that you want to make sure you're addressing, which leads me to the second thing I want to make sure we're thinking and saying the same, which is it feels as if we're two sides of the same coin, meaning our philosophy is that we want to make sure that there is movement and stability in the spine, both because of the long-term impact of being misaligned, accelerating osteoarthritis, basically degeneration of the joints and the bones. That's number one. Number two, the obvious impact that misaligned bones are going to have on the very sensitive nerves inside and coming out of the exact areas we're talking about. And from that area, again, I mentioned the coin, we look often for the hypo areas, the stuck or fixated areas that don't have as much movement. And you're looking for the same thing from the opposite extreme, I will say, which is those areas that have too much movement, and you're looking to stabilize them with orthobiologics that you use. Do I have that?
But let me just tell you, we also are committed to the hypomobile segments, particularly the thoracic kyphosis, because we all know that with thoracic kyphosis, you can't move your neck. I can inject PRP or stem cells all day long, but with the thoracic kyphosis, unless that frozen or that hypomobile segment gets mobilized, we're going to get subpar clinical results. So thank you for that summary.
I just like to make sure, we're all saying the same thing. There's all these words going around, and words can have different definitions and so on. And, our goal for our group, our smart chiropractors, to really understand and embrace that all medical doctors are not bad. They're not all against us. In fact, many agree with us more and more. And your practice in particular specializes in working with both orthopedic injuries, but also you've got extensive experience both co-managing patients with chiropractors, and you happen to have a lot of clients or patients who are in fact chiropractors themselves, very much because of what we're talking about. My question for you is, in your experience, both working with chiropractors and treating chiropractors, or providing care to chiropractors, as I prefer to say, what have you found to be some of the surprising responses or reactions from chiropractors when they work with you and realize, wait, we're on the same team, rowing in the same direction? And when we think of serving people based on their needs, not just ours, it comes to be obvious that many people, again, who have, I'm not saying everyone needs orthobiologic injections, but those people that have orthopedic injuries who are looking to avoid drugs and surgery don't have a better place to go than you. What have you found that chiropractors sort of have learned or, been surprised about in either co-managing and or?
So great question, and I think you've already hit on it. It's the aha moment. It's that light bulb going, hey, they're on our side. They're on our team, as opposed to being dismissed. There's nothing more rude or insulting than being dismissed as a provider. And what we found that and I've seen this time and time again, that chiropractors enjoy working with us because, number one, there's a level of trust, a level of integrity, and they know wholeheartedly that there are patients coming back to them and that we are going to work together. Those are the aha moments with chiropractors.
John, I think it is super impactful. I appreciate you coming on. I absolutely want to respect your time because I know you have a whole array of people to see this afternoon. Clinical Conversations is all about exactly what we've spent the time doing, which is better understanding what's out there in the medical space, understanding who are those complementary care providers like you that we can lean on and chat with and understand more to better serve our patients. I can't wait to have you back in the future. There are an array of topics. We've just barely started to skim the surface, but I want to say I appreciate you coming on and your team of doctors because it opens up a whole world of knowledge to our smart chiropractors, and it opens up a world of knowledge to me. We continue to learn more together. I think that's how we'll get farther. So John, thanks so much for coming on. Docs, thanks for listening in and tuning in to this episode of Clinical Conversations. We'll be back in a couple of weeks. Until then, have a fantastic day in practice, and we'll talk to you soon. Bye. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.